Good morning, everyone. My name's Carla Macias, host of San Antonio's own medical show, Best Docs Network, featuring Forest Park Medical Center. We've got a great show for you today, and in the next 30 minutes, we'll be featuring doctor-patient stories from specialties such as urology, family medicine, and facial plastic surgery. Now let's get today's show started by introducing one of these Forest Park doctors, ENT, otolaryngologist, and facial plastic surgeon, Dr. Jose Barrera.
I wasn't very confident. I wasn't very outgoing. And that's something that kind of started back in high school when my face really started to change. I think one of the main things was that I would feel very, very uncomfortable when someone would look at me from the side. And so then that's when I suggested to my parents that I was considering a rhinoplasty. I guess it's a family nose. I had a very large hump on the bridge of the nose. When I would look straight ahead, you could kind of tell it shifted towards the right. My first consultation with Dr. Barrera, I was really nervous because I wasn't really sure what to expect. He was very approachable, he was nice. We decided to go with the rhinoplasty. Dr. Barrera was very specific on what he was going to do on me. All the work he was going to do was basically going to be inside, so that kind of put me at ease.
We often see patients who present for rhinoplasty for many reasons. Some patients come in because they have a functional problem, they can't breathe, they have a twisted nose or a crooked nose, and so we aim to straighten the nose. And many patients come in for aesthetic rhinoplasty. You want the nose to look great, to be very aesthetic. If it's a female, you want a very feminine nose. If it's a male, you want to preserve some of the masculine characteristics of the nose. At the same time, most people prefer a very straight profile. Now, the recovery for rhinoplasty surgery is pretty expedient. Patients wear a cast for about a week, and then the cast is removed.
This procedure has not only changed my life physically, but emotionally as well. I'm more confident. I feel like when someone asks me a question, I don't have to turn and look at them back then. I don't want anyone to see me from the side. Dr. Barrera, I think he is an amazing plastic surgeon. He's very kind, he is approachable, and I think the fact that he specializes specifically in the face makes the patient feel more comfortable. He's definitely the person to go to, especially if you're wondering what fits best for you.
That's our goal, is to achieve very harmonious, aesthetic rhinoplasties that still function and breathe well.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. Plastic surgery is the process of reconstructing or repairing parts of the body, especially by the transfer of tissue, either in the treatment of injury or for cosmetic reasons. Dr. Michael Baumholz is a plastic and reconstructive surgeon here in the San Antonio area. Now let's meet the doctor.
I'm a plastic and reconstructive surgeon with additional specialty training in hand and microsurgery. I have a broad-based practice encompassing both adults and children, cosmetic surgery, reconstructive surgery, and hand surgery. I talk to and treat patients like I want someone to talk to and treat my family. And it's age and process specific. So the young woman that's considering a breast augmentation, or the young child that's been injured, or the older woman that would like a facelift, these are the kinds of people that I try to relate to as my own family members. I try to be as honest and straightforward as I know how. I talk to people not in medicalese, but straightforward, easy to understand ways. And I think that helps me connect more quickly and more deeply with the patients I look after.
Forest Park Medical Center is your destination to better health. Their motto is just one of the many great things about this one-of-a-kind facility. Up next, we're going to hear more about what Forest Park is from the San Antonio CEO herself, Julie Seal.
Forest Park Medical Center in San Antonio is located at the southeast corner of I-10 and 1604. And it is at a stunning location. at the beginning of the hill country. It sits up on a hill. The views from the rooms and the patios are breathtaking. The facility is like a five-star hotel, but with a hospital inside. And hospitals can be intimidating and scary places, and when you walk in, there's this unique smell, and the artwork takes your attention. The facility and the water features are very calming. The patient rooms are outstanding. They're appointed nicely. They're also comfortable for the patient's family. If the family would like to stay with the patients, it's comfortable for the families as well. We have 16 VIP rooms, which are basically family rooms. It's a room inside a room where the patient's family can stay with them. The other piece that's really interesting is we've tried to take into account all of your senses when you come in, and everyone jokes about hospital food. Well, not at Forest Park Medical Center. We have a chef, and our facility and cafeteria and food service is outstanding. It is second to none, and we pride ourselves on that, on being different and unique. We really do work to make sure that it is a calming environment and helps improve the healing of the patients. It's reassuring for the families as well when they come there, that they know that they're not just part of a large quantity of patients, a large number. It's unique and specific for that patient, and the care and attention is given to the patients and to their families. The Forest Park model is unique in that it is majority physician-owned, and the physicians do make the decisions locally about the care, about the facility, about the equipment that's offered. I'm extremely excited to be a part of this project. It's something to be part of a project from the ground up, and I've actually been here from the beginning with this project, and to see a difference that it's making in San Antonio and to see the excitement with the physicians. They're very excited about the new facility, about having a place where they can call the shots. The nursing staff that we've hired to date is outstanding. San Antonio will be the first hospital that has its own cardiac cath lab. This hasn't been done in any other hospital that Forest Park has ventured into in any other market, but it made sense for this community. And so we're very excited about that. This type of facility is tailored to the needs of each individual community. It's not cookie cutter. It's what makes sense for the city of San Antonio and the physicians involved in this project.
Aaron has a question for Dr. Saeed. What are some of the causes that would lead someone to have a revision of a total joint replacement?
Some of the more common causes of needing a revision total joint replacement are implant wear, implant loosening, dislocation, as well as a small chance of an infection. As with any surgery, there's always a chance of an infection, and this also goes for total joint replacement surgery.
Once you saw this mammogram, you can tell that the skin here is normal. But if you look at the skin here, see how much thicker this skin is. But if you look at her breast doesn't show you a certain spot that is having issue. There is no microcalcifications that look suspicious. And there is not a tumor that you can pinpoint to, nothing. So you know that there's something going on. It could be just a simple inflammation causing, or mastitis causing this skin thickening. But it turned out that the patient had a really big cancer. This is the same patient that we just saw on the mammogram. This is the MRI, Aurora MRI. You saw there's an abnormality there. And when we go to this panel, you see there's redness. This red area here, those are all cancer. And the blue area, that's the swelling of the breast. So see, it's very diffuse. And the blue area is the swelling associated with the cancer. Our MRI can do three-dimensional. You can see the chest wall, the heart, and the armpits, the axilla, and the nipples here. And you see the difference between the two breasts right off. There's something going on here. See the difference between this breast and that breast? The redness is all cancer. There's a big difference between what mammogram and MRI can see. Mammogram is two-dimensional, and the density all jammed together. So it's very hard to differentiate a dense breast tissue versus a cancer. Now MRI, you can tell right away. This is a breast ultrasound, and this is at 3 o'clock position of her breast. And because after the MRI, we already kind of know where the problem is, so we use ultrasound to focus where we can sample, and that's where our needle went through here to get the diagnosis of cancer. This is where ultrasound shows some abnormality. We are using the ultrasound, we call it a second look ultrasound, after the MRI, and zoom in on where the problem that we can see on the MRI, and using ultrasound to guide our biopsy needle. And we sample that area, and it was cancer.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
Weight loss could be a challenge, and remember that weight gain didn't happen overnight, so it's going to be a gradual process. It is important to keep in mind that when we consume diets that are high in carbohydrates, carbohydrates eventually will turn into sugar, and then the sugar will cause insulin release. The higher the level of insulin, the more weight you gain and the more hungry you feel. So what you want to do is try to keep insulin levels to a minimum. What you have to do in this case is follow a diet that's high in protein and very low in carbohydrates. By doing this, not only does it help you lose weight faster, but at the same time it'll bring down your triglycerides and your blood sugar. The other concept that's very important is to have a high fiber content in your diet. The higher the fiber, the slower the carbohydrates get absorbed. Try to consume portions that are about the size of your fist. So remember, 2 vegetables, 1 protein, and 1 carbohydrate. Also try to incorporate snacks that are high in protein. For example, nuts, low-fat cheese, and Greek yogurt. Make sure you limit trans fats and saturated fats and alcohol drinks, especially things that have a lot of sugar. For example, mixed drinks. Make sure you drink 6 to 8 glasses of water per day. It'll make you feel full and at the same time stay hydrated. So exercise regularly for at least 30 minutes a day, and make sure you keep your total number of calories to a minimum. For example, 1,500 or less usually will help you lose weight. Some people may need more, some people may need less, so make sure you check with your doctor.
The #1 priority at Forest Park Medical Center is patient care. The staff makes sure to pay attention to every detail, from the nurse-to-patient ratio to the level of comfort found in every room, as well as the quality of food provided for each patient. Up next, we're going to take a look at the dining experience and show you how Forest Park Medical Center's cafe is not just your ordinary hospital food.
I'm the Director of Food and Nutrition Services here at Forest Park, San Antonio. My scope of responsibility is to provide food service to all the patients in the hospital, as well as the staff and the patient families that come to visit their loved ones here at the hospital. We like to operate here as a hospital that will be within a hotel setting. So everything that we do is predicated on offering good quality food, great variety, and top-notch service. I draw a lot on my background, having worked in hotels and restaurants and country clubs in my prior assignments, to bring that level of flair and service to this operation. The head chef is a lady from Thailand. Her name is Bibi Stillwell, and she does an amazingly good job here, bringing in a lot of Asian influence for a little bit of variety to what we do every day. We have a wonderfully diverse department, very representative of the community that we serve. Everybody, as they come in, are put through rigorous training to make sure that we follow all of our recipes and procedures, and we very actively encourage them to bring forward their own ideas, which we can then incorporate into our ever-changing variety of menu items. When you walk into our cafe, the first thing you notice are the floor-to-ceiling windows with the great hill country views. We have fresh flowers on the table, artwork on the walls. So we want to get away from the sterile and somewhat non-welcoming environment that is found in many hospital cafeterias. We have a fixed menu of items that we have all the time so that people can count on something being available, but we pride ourselves on an endless variety of fresh prepared dishes that we change on a daily basis. Everything here is prepared fresh to order every single day. We do not use prepackaged foods. We buy the best foods from the leading purveyors in town. One of the items we're the most proud of is our woodstone pizza oven, where we can prepare a variety of pizzas and flatbreads. The dining aspect of patient care is very important for a patient's speedy recovery. We have to be aware of potential limitations. Our patient menus are carefully calibrated by dietitians to ensure they meet the nutritional needs of a patient. As soon as we can, we progress onto the foods that they like, and it really helps physically and also psychologically with recovery. When people first come into our area, we want them to think that they are not in a hospital, that they're inside a very nice hotel that is focused on good quality food and great service.
Forest Park was one of the major sponsors for the Balloon Festival, and it was quite interesting. I'd never taken part in that before, and a group of our employees got together, and we had different shifts, and we were able to sit there and we gave out different information about our hospital.
Forest Park was right in the front, right where all the balloons were set up, so we had the prime location. Most of the traffic would come right in front of us, and we had the game of Operation that the kids can play, and they loved that. And we also had these little Forest Park temporary tattoos that had a little balloon on them, and you would think that we were giving them $1 million. They loved that.
Forest Park is about serving the community, and so we want to get out there and let them know what we're about, and the Balloon Festival was just one of those events.
It's very important to me, our involvement in the community, working for Forest Park. I mean, it's really a huge part of why I chose to come to Forest Park. And when I was asked to be involved in the Balloon Festival, I was like, absolutely, I would love to share all of the great things that I know about this place.
If you've never been in a hot air balloon, this was quite exciting. And we were so fortunate to have that front row seat, if you will. Those balloons are so big. I mean, the field, they had, I think, anywhere from 20 to 30 some different types of balloons, different kind of animated characters.
It was a very good experience from the beginning to the end. We had a lot of people come over very interested in what Forest Park was. We had the first aid station just in case somebody had come by and had a little bump or scrape or something like that. And we had these little Forest Park teddy bears with little shirts on them that we can give to them if they had a boo-boo. We were very prepared in the event that we needed any kind of first aid. We had all of our supplies available.
I just like the opportunity to be out there, visit with the different people in the community, and tell them about Forest Park. We want people to know what we have to offer in the community and what great services and things we have.
Probably most important obligation and job is to prevent illness and maintain health. They are two different things. As a primary care physician is our main mission. We have several ways to do it, especially direct contact to the patients, patient education, counseling, reinforcement. One of the main cause of death in the country is cardiac disease. Heart attacks, strokes count also. And the main reasons are hypertension, high cholesterol, inactivity, smoking, stress, and diabetes, of course. We want to help to prevent that to happen. For the last 5 years or 10 years, has been noticed a marked decrease on the cardiac events. And mostly it's due to the media to the doctor's education, but we still have a long way to go. We do physical exam, contact with the patients, lab studies, blood studies, x-ray. When we discover or find out particular problems, then we talk to the patient. We start with the medicine right away if it's necessary. Exercise, dieting, decrease the stress, modify your environment. We believe that physical activity or the inactivity is as important as the other illnesses to cause cardiac events. So we emphasize on the medicines, on the dieting. We focus on the exercise because we believe the lack of activity is one of the major causes of cardiac events. Unfortunately, San Antonio is one of the highest in child diabetes. We cannot wait until the patient gets the age of 25 or 30 to start doing something. We need to start from day one. Some of the patients says, give me my medicine and I'll see you next year. That is not right. We prevent further damage by seeing the patient more often.
By heading over to bestdocsnetwork.com, clicking on San Antonio under the Our Doctors tab, there you could browse through all the different specialties a part of this network, as well as watch hundreds of more educational videos. Now, one of those doctors you can find on our website is San Antonio Urologist, Dr. Juan Reyna. Now let's listen as Dr. Reyna discusses kidney cancer with one of his patients.
I woke up one morning and had a real strange cough that I had never experienced before. I finally went to this doctor who's a GP, and she told me, it's just probably allergies. I let it go a couple more days and it didn't get any better. I contacted the scheduler for the VA, and I told him that I wanted to make an appointment with my primary care. What he told me was, if you feel the way you do, you need to go to the VA today and tell them what you're feeling and that you want an x-ray done. He took me into one of the examining rooms. She told me, we did find a nodule in one of your lungs. So that evening, I went home and I contacted Dr. Reyna.
Ernie came to me about 2.5 years ago and said he had been losing weight and he had been coughing and that he just wasn't feeling fine. He had gone to the VA hospital and had some x-rays and they had told him there was something wrong, but they didn't tell him what. So he came to me with the x-rays. And I was able to look at the films, and Ernie had a huge tumor in his left kidney. So big, in fact, that we felt that there was hardly any other way than to do a large operation to get the tumor out. Ernie survived the operation. He had a slow recovery, as you might imagine, from something that big. Once again, Ernie's at the point where we have no evidence that he has any cancer in his body at this point in time. The whole evolution of how we treat kidney cancer has changed over the years. It used to be that if you found a patient like Ernest, you could almost be sure that he would probably be dead within 6 months. But now our approach has been to get these tumors out, get as much of the tumor mass out as you can, and then to remove all the spots that you can see that are evident to you in terms of metastasis.
Today, I feel wonderful. I've been under wonderful care from these great doctors. And my daughter, she's been with me the whole time. She cared for me, trying to stay proactive with my health and my diet, you know, and exercise. Dr. Reyna saved my life. He saved my life by reacting immediately upon the fact that he saw what was going on in my body. I do say that he played a large role in why I'm still here right now.
My position at Forest Park is the Director of Staff Development. I am in charge of the education program throughout the facility. The employees not only learn the first day that they are employed at Forest Park, but it's a continuous process. What I am excited about is the physician involvement in the education process here at Forest Park. The physicians are very engaged in making sure that staff involvement in the education process is continuous. They're invited to come into the operating room if they are a nurse in another area, so they have a better understanding on how to take care of that patient, especially controlling their pain while they are recovering at our facility. We are going for our AOA accreditation here at Forest Park, just as our other sister facilities are. And so there are lots of standards to raise the bar on patient safety and patient care. On a daily basis, we are striving to make sure we exceed those standards by making sure that our staff feel that they have the tools they need to succeed and take care of their patient. Learning every day is why we're here, and it makes Forest Park an exceptional place to work.
Didn't find the right doctor you were looking for on today's episode? Head to our website, bestdocsnetwork.com, and there you can browse through all the different specialties a part of our network. If you have any questions or comments, please feel free to email us at bestdocsnetwork.com. I'm Carla Macias, and thank you again for joining us on another episode of Best Docs Network featuring Forest Park Medical Center. So long, everyone.